The following video will outline the contents and suggested applications for the Sage Urinary Catheter Pack, numbers 10, 11 and 12. Please note, the video content is for informational purposes only and is not designed to replace your provider's policy and procedures. The Sage Urinary Catheter Packs are available in various configurations suitable for use in community or hospital healthcare settings. All catheter packs present in a convenient peel pouch with an impervious 60 by 60 cm sterile field. Each pack contains a fenestrated drape, 5 X-ray detectable gauze swabs, lubricating jelly, a 30 ml sodium chloride ampoule, and a 10 ml Purifil pre-filled water syringe. Pack 10 contains only one long OPS tray. Packs 11 and 12 contain 2 long dressing trays, an absorbent medical towel, and 3 long green forceps. Packs 10 and 11 also contain the addition of a catheter securement device. Contained in each pack are a long dressing tray and a 30 ml sodium chloride ampoule. Each tray has 2 dedicated gallipot sections and a large internal space. The gallipots are designed to hold fluid and are suitable for holding the sodium chloride when decanted from the ampoule. The side gallipots can hold 30 ml fluid each, while the entire tray has a capacity of 420 ml. The internal ridges inside the tray can also be utilized to roll and squidgy excess fluid from any soaked gauze. The edges of the tray are also rolled to provide extra support and stability to minimize any fluid spill. The 5 gauze swabs in the pack each contains an X-ray detectable filament, making the pack suitable for use in all hospital departments, including the operating suite. The X-ray detectable filament expands the scope of the pack and diminishes the need for specialized pack configurations in each hospital department. The 3 forceps contained in packs 11 and 12 can be utilized for the assembly of the contents upon opening the pack, holding of the gauze and components during the procedure, and for patient cleansing. The drape contained in the packs is 100 centimeters in length and 80 centimeters wide, with a non-adhesive 9 by 18 centimeter fenestration, and is suitable for all genders. The drape is folded in a concertinaed pattern to ensure the fenestration can be exposed and positioned, while the remainder of the drape can be applied using an aseptic technique. Unique to the Sage Urinary Catheter Procedure Packs is the addition of the 10 ml Purifil pre-filled water syringe. The Purifil syringe is a convenient pre-filled water syringe designed to save setup time, waste and minimize infection prevention breaches. The 10 ml Lua slip syringe is preloaded with 10 ml of water for the inflation of the catheter balloon. Simply remove the black cap from the syringe tip and insert it into the catheter balloon lumen for fast and efficient inflation. Included in packs 10 and 11 is the Sage Catheter Securement Device, intended to secure your catheter and minimize any catheter tugging, dislodgement, and patient discomfort. For application, remove the backing paper and secure the dressing to a clean, dry surface on the patient's thigh. Placement of the device should ensure that there will be no tension on the catheter lumen once the catheter is secured in place. Once in place, remove the middle piece of backing paper and secure the balloon lumen to the exposed adhesive. This will assist in extra catheter securement. Thread the smaller tab through the fenestration and secure in place. Pull the larger tab over the urinary drainage lumen and secure in place. For more information on Sage Urinary Catheter Procedure Packs, please visit www.sentrymedical.com.au/access or contact your local Sentry sales specialist for more information.